Hi, so I'm going to do a little instructional video on how to withdraw your medication, whether you're using semaglutide or tirzepatide. Pretty much the same theory is going to be for each. I'm going to wash my hands. I still recommend you guys doing that even if you're at home. Okay, so with the same alcohol wipe that you can use to clean your skin, I'm going to do this. If you are not pulling that cap off, okay? I do recommend pulling the cap off though. You'd be surprised how much is still in there. So once you pull the cap off, like this one here, you get this little device. They're like a couple dollars on Amazon. Just search like medicine bottle opener. It's just like a bottle opener. And you hold it really steady. Pull that off. And then this little gray part pulls out. And then you throw the silver away. Okay, so it's very useful. I'll just use the bigger syringe. I dose all my medications, all this in 10 units. So if your dose is the semaglutide 0.25 milligrams, that's equal to 10 units. So if you're on 20 units, that's 0.5. If you're on 30 units, that's 0.75. If you're at 40 units, that's 1 milligram. So 10 unit increments is usually what I do. Sometimes if you're a little older or if many different reasons, I may do 5 units at a time, but for the most part, it's always 10, okay? The tirzepatide is dosed a little differently in that it is 2.5 milligrams per 10 units. So again, every 10 unit increment, we've got our 5 milligram, and that's 20 units, and then 7.5 milligrams is 30 units. So there you go. And so on and so forth. So I have 2 different syringes. This goes all the way up to 100 units. Okay. This one goes all the way up to 30. All right. When you're talking to somebody else and they're like, oh, I'm on 70 units. You don't know how many milligrams that is unless you see their bottle and you know. Or if they happen to say, I know that I'm at 70 units, which is really 5 milligrams or something. Everybody's concentration is different depending on where they get it from the compounding pharmacy. Mine is this one. Please don't come in here. Okay? So, semaglutide. I am drawing up, putting a little bit of air in there. Drawing up 10 units. There you go. Now, let me show you what happens. Ooh, air, lots of air. Hold it up to the light, hold it steady, give it a little flick. Wait for those bubbles to go all the way to the top. All the way to the top. I don't know if you can see it. You can't see the bubbles, but anyways, just pushing it up, and now we have no more bubbles, okay? Pretty simple. That's how that is done. Okay. Now tirzepatide, well, I'll just do it with this one. Just checking my medicine. 10. We'll do 30 units. All the way. Done. 30 units. No bubbles on the inside. Be very careful when recapping. That's it. Bye.